Hello, so in this video today, I want to kind of keep it a little low since it's late, but I want to go over the do's and don'ts, like right after you give birth. I want to give a shout out to my beautiful mama subscriber who just gave birth to her two little, I didn't see them, but I can already tell, or I already know they're two beautiful little babies, and congrats mama, by the way, Chelsea S. Congrats, and I'm so proud of you. And you got two little blessings at once. But okay, let's go into the videos. So obviously, the first thing after you give birth is you don't have sex for 6 weeks, even 8, and over, because you want to make sure you're really healed down there. And like a few other things. Okay, there's a couple really important ones. And for starters, is make sure you get enough rest. Because after you give birth, it's hard work giving birth, so you want to make sure you get enough rest, enough sleep. Also, this is actually probably one of the top most important things, maybe even above getting enough rest, or actually they're both an equal part. But make sure you eat enough. You have to eat after you give birth because your body needs that nutrients and stuff, because you just pushed out a baby, so your body needs all the help it can get. So make sure you're eating enough. And this is another very important thing: take multivitamins. Keep taking prenatal vitamins after you give birth, while you're nursing, and when you're done with pregnancy. You always want to keep them vitamins going, especially if you're a woman, because it is very important. We need a lot of nutrients. And I'm going to link in the description the best prenatal vitamin to take and get for women, because I take it daily. It helps a lot, and you really do need vitamins. So take vitamins. And also, this is for you and baby, and also it's really a personal preference, up to you, but limit the visits for a week or so. Limit the visits so you can make sure you're bonding with your baby, you're getting enough rest, and you're getting enough sleep, and you really feel to people coming to see you. Because I know, when I gave birth, I hated when people just came unannounced, because I didn't know, and it was just make sure you're prepared. And also, I would recommend just wait a week or two before, or even a month before anybody comes and visits you right away. Now your mom, stuff like people that are really close to you, that's different. But just make sure you're comfortable with more sleep. Seriously. Babies sleep about 16 hours a day. Okay, so that gives, so mama, you're getting maybe 4 or 5, 4 hours here and there, right? But the best, I know this is said numerous times and I hated hearing it, but it's true. Sleep when your baby sleeps. When your baby is sleeping, I know it's tempting to do something you want to do, because you want to do stuff too. You don't want to be stuck up cooped as a mom. But make sure you're sleeping. You need that sleep. You need that sleep for recovery, and you need that sleep. So make sure you're getting sleep, and especially sleep when the baby's sleeping. Be patient with breastfeeding. I know. I advocate breastfeeding on my channel, and I think every woman should breastfeed, and formula should be prescribed. But be patient with yourself, because it is hard. Ask for help. Ask a lactation consultant. Message me if you need. I will try to help you the best I can. But number one thing is be patient with yourself. Be understanding to, hey, I've never done this before, or I did this before and it just didn't work, or I don't know how to do this. Be patient. Take a deep breath. Relax. Reach out for help and try, okay? Because it can be hard. It can be frustrating, especially if you don't know how to do it. And Chelsea, I know it's going to be tough having twins and doing it, but my best advice in this area for you is get a boppy pillow, and put it there, and put them both, take their heads and just put them on your boobs. Remember, just be patient. Be patient with yourself, mamas. It's hard. It is hard being a mom. You just gotta be patient. And you might not want to hear this. You're like, oh, I just gave birth. Don't tell me anything about this. Get doing Kegels. Okay, wait maybe like a week or two, but do them Kegels. Do them like 10 times twice a day, daily. Because you really want to strengthen the muscles back up after you have a baby. Because if you don't, it's going to be hard like to hold your pee in and stuff like that. Because you need those muscles. This one is going to get a little messy. Give your vagina some tender, loving care treatment. Not sex, but I mean like suds baths or sitz bath or a warm bath, and just, gently clean down there. Gently, get all that blood off of there, and even just relax and sit in the tub for a little. Every time you pee, especially right after you give birth, you're gonna have to use a bottle and squirt yourself with warm water to squirt yourself clean. I'm also going to put a link in the description about, it's called the Mommy Washer. It is a must-have. Like 6 to 10 weeks, you actually should be okay, afterwards if you are wanting to have sex. But even me, I'd recommend waiting a little longer than that, but you actually can after that. Ask for help if you need it. Don't be afraid to ask for help, mamas, okay? You gotta ask for help sometimes. I have my 2 daughters, and one's 3, and my other one's a year and 3 months, and I need help sometimes. Okay, I gotta ask for help sometimes too. Gotta ask for help. Don't be afraid to ask. And I want to talk here about pain. What to do if you're having pain for afterbirth. One is ibuprofen. Ibuprofen is okay for you to take ibuprofen and Tylenol. Well, not together. One or the other. Ibuprofen or Tylenol. And take that as every 6 to 8 hours. A warm, like a heating pad across your stomach, and maybe even across your strip there where your vagina hair is. Put that there. You can, and this is gonna sound really weird, but it actually does help for pain. After you give birth, take some condoms, fill them up with water, and freeze them. And then what you do is you put it, you don't insert it. Do not do that. What you do is you put it on your, you put it at your underwear between, so if this, say I just gave birth, okay, you put it, and here's your underwear, you put it right there in between your vagina. That way it's cold, and it'll help with the swelling, and it'll help with the pain. So them are my tips for pain. Also for if you're breastfeeding, make sure you're switching sides, and if you feel you're really full, remember, don't pump all your milk out. Just pump a little till you feel comfortable, okay? Because if you pump all your milk out, you're going to be in worse pain because you're going to make more milk, and your boobs are going to really hurt. Now, if your baby's having trouble latching because you're so full, squeeze some out or pump some out till you can get at least, a little grab so your babies can latch, grab the nipple. Make sure you have a deep, good latch. But alright, mamas, and Chelsea S, again, congrats. I'm so happy for you and proud of you. Alright guys, there's 2 other things I want to say here. You cannot wipe after you give birth at all. So you have to just use the Mommy Washer. And 2, make sure you make your partner help you. Your partner, say you're with your husband, he needs to step up, man up, and help you. Men, you need to step up, help women, and respect women more, because after you give birth, you need help. And if you're part of that baby, you're the dad, you need to get up and help her also. So make sure to tell your partner that he needs to step up and help you, because you need help after you give birth. Hope my video helped you. This video was mainly for everybody, but because she really recommended me to do it. So I hope I helped, and I will see you in my next video. Bye-bye.